I want to discuss with you brow lifts. You've chosen to go forward with a brow lift procedure, and I want to discuss with you recovery time and potential complications. So a brow lift procedure can be done a number of different ways. It can be done with, most commonly in our practice, endoscopic assistance, so it's minimally invasive. There will be 2 little incisions on each side of the midline and 1 in the widow's peak area. Through that, we can accomplish a very effective brow lift result with subtle but meaningful elevation of the brow without a surprise look, and we can do that in a minimally invasive way. There are times we will do the incision all the way across the front of the hairline in order to move the hairline forward, especially. There are times we will use even other approaches, but those are the 2 most common we do. In general, recovery time for the brow lift component only is relatively short, with most individuals being very presentable at 5 to 7 days. There are commonly some ridges or I call them speed bumps along the incision, whether it's done all the way across or just the individual incisions. Those resolve, but they take several months to resolve, and commonly we recommend wearing a scarf or adjusting your hairstyle to cover them. There can be bruising, and certainly that normally resolves by 10 days. Noted complications in literature that we see very little or never have seen include a damage to the facial nerves, such that one cannot raise the eyebrow on one side. We have not seen any permanent cases of that. With a prior technique, we saw some temporary weakness, but we certainly haven't seen any in 10 years. There can be hair loss, temporary or permanent, around the incisions. With the endoscopic especially, we have seen no cases of any permanent hair loss around the incisions. There can be visible incisions. If you start off with brow asymmetry, we will normally try to improve on that symmetry by doing a more aggressive lift on one side versus the other. However, no one in the world can fix preoperative asymmetry. Again, very highly successful procedure, and we look forward to seeing your end results.